Why do autoimmune conditions cause severe dry eye syndrome? Imagine your eyes as a well-oiled machine that needs proper lubrication to stay healthy. When autoimmune conditions are involved, your body's immune system mistakenly targets its own eye tissues, causing a cascade of problems that lead to severe dry. This happens because the immune system attacks the tear-producing glands, especially the lacrimal glands, which are responsible for making the watery part of your tears. When these glands get inflamed and damaged, they can't produce enough tears, leaving your eyes feeling dry, irritated, and sometimes gritty. In autoimmune diseases like Sjögren syndrome, rheumatoid arthritis, and lupus, this attack is even more pronounced. The immune system doesn't just target the tear glands but also causes inflammation on the surface of the eye itself. This inflammation disrupts the delicate balance of the tear film, which is made up of layers that keep your eyes moist and protected. When this balance is disturbed, tears evaporate more quickly, and the surface of the eye becomes vulnerable to damage. Certain immune cells, such as T cells, especially the Th1 and Th17 types, play a key role in this process. These cells perpetuate inflammation by releasing chemicals called cytokines, which attract more immune cells and cause ongoing tissue damage. This chronic inflammation not only reduces tear production but also affects the cells that help maintain the health of the eye's surface. Tears are made of three main parts: water, mucin, and oil. Autoimmune diseases can also damage the meibomian glands, which produce the oil layer that prevents tears from evaporating too quickly. When these glands don't work properly, tears become poor in quality and evaporate faster, worsening dryness and discomfort. People with autoimmune-related dry often experience symptoms like burning, redness, blurred vision, and sensitivity to light. If left untreated, the chronic dryness and inflammation can lead to corneal damage and increase the risk of eye infections, which can threaten vision. Autoimmune diseases that commonly cause severe dry eye include Sjögren syndrome, which specifically targets tear and saliva glands, making dryness a major issue. Rheumatoid arthritis can also cause inflammation of the tear glands and the surface of the eye, sometimes worsened by medications used to treat the disease. Lupus, a systemic autoimmune disorder, can affect tear production and the health of the eye surface as well. Other conditions like Graves' disease may involve inflammation around the eye, impacting tear production and surface health. Managing dry, caused by autoimmune conditions, involves treating the underlying autoimmune disease to reduce immune system activity and inflammation. Doctors often recommend anti-inflammatory eye drops or medications to calm the immune response. Using artificial tears and other lubricating products can help provide relief, but controlling the immune system's attack is essential to prevent long-term damage. In summary, autoimmune conditions cause severe dry because the immune system mistakenly attacks the tear glands and surface tissues of the eye. This leads to inflammation, reduced tear production, and unstable tears, which all contribute to the uncomfortable symptoms and potential damage seen in these cases. If you experience persistent dry eye symptoms, especially if you have an autoimmune condition, it's important to consult with an eye care professional for proper diagnosis and tailored treatment options.